take the accessibility in terms of how far it is from the hospital. Okay, some has less than 4 kilometers, like this area is closer, but those are quite far have like more than probably around 50 kilometers from the hospital. Okay, this is the map on higher education. This is higher education institution. Obviously, most of these centers are located in urban area. So basically, the people living in the urban area have more benefit, and when compared to those in the remote area. So the same goes here. We are trying to map out and see which area has high accessibility with the higher education institution. This is just the physical factor. We are looking at spatial factor. Our second phase would be going to the fields. One, we combine all these maps and then try to find which area are lacking in terms of opportunity, accessibility, and so forth. The two maps showing access to urban center, major urban center here. So we map out. So obviously, people within urban area are having more advantage. While this is a bit different, this is I map out the number of degree holders. Okay, just now I just map out in the physical location between people and the location of higher education institution. But this one we look at the number of people having degree above. At least a bachelor degree and above. Okay, if we can relate back to the previous map on this one, looking at the state where I come from, Perlis, and look at this one. Okay, less people having. I hope they count me in. Okay, so this one like. Well, only this is urban center. It's about like less than about 3 or less than 1,000 people having a degree. So how can we get a higher income? People with high income if they haven't got a degree to be one of the criteria for moving towards high income. Also, you can argue that businessmen, they don't have degree. They didn't go to some of them didn't go to college to finish the degree to get to be a billionaire or millionaire, but still this degree is like one of the criteria used to ensure that you get a better job and so far. Okay, this is demographic burden. Demographic burden is calculated based on number of usually for demographic burden we combine youth and aging population, meaning that those in retirement age, 60 and above, some countries use 65 and above. In this study, I use 60 and above. We look at where these people are when compared to the population as a whole. So, well, some of the districts have high percentage of aging population. This will cause, we have several implications in terms of policy, in terms of services where this aging population needs to be taken care of. For example, some countries that are facing problem with aging population, for example, Japan, and so forth. Well, one day, some people, I've read somewhere that saying that one day they will have this problem with aging population where not enough productive population to continue growth. While this is for youth, okay, some area has a smaller number. This is not data. I think somehow some problem with my calculation. So we can see that these two criteria also can be combined to look at where is the area that need to be targeted. Okay. Then looking at this, what we did was we looked at the state level. Just now we do the whole northern region. What you mean by being poor in urban area is not necessarily without housing, okay? But the housing condition is not good enough, or is like you have to survive with whatever you have. This is example of low cost flats in Penang, and this is like we call it tanah tumpang, squatters. Yeah, because the Penang didn't like to be called squatters because they've been living there for so many years, but the land has changed ownership sometime, so it can be called squatters, but these are the conditions that we find from our study. And then, based on that, we map out the population, okay, the poor population, okay. The blue one is household with the blue one is low income or poor population, and then we map out the hospitals in Penang. For example, these are the hospitals. Okay, we found that some area they are lacking or lack of access. They have lived like as far as 5 kilometers from the hospital. For Penang, it's not so bad because it's considered an urbanized state with high income, among the high income state in Malaysia. This one we try to look at in terms of accessibility to food items. Okay, we survey the food outlets that selling nutritious food, and then we look at accessibility of these people to the accessibility of the people in general to food outlet in Penang. Well, we find some areas that are lacking access to food. For example, around here, this is Penang, the mainland of Penang, and this area here, and also some small area here. This is access to healthcare. Okay. By the way, just to share with you that in this one we put healthcare and also we put cancer patient. We map out cancer patient and we try to calculate the accessibility using GIS. How accessible this cancer patient, particularly breast and colorectal cancer patient, to healthcare. Okay. So we found that some area, like here, they are lacking access to healthcare. Okay, so these are the areas where we're going to go and do field survey. In our second phase, first phase we do the mapping and identifying areas that are deprived in terms of health, in terms of accessibility to health, and then we will do field survey. And then other one is that access to Kedai Rakyat Satu Malaysia. What you mean by Kedai Rakyat Satu Malaysia? In Malaysia, the government has opened up a grocery store called Kedai Rakyat Satu Malaysia, meaning people shop that sell daily food items at a cheaper price. Some products are like as low as 60% from the ones that sold at the supermarket or other grocery store. They put it in many places. In Penang, they have like the red one. This is the red one is the location of Kedai Rakyat Satu Malaysia that we survey. And then, by the way, this is Georgetown, the major town in Penang. What we did here is that we also interview the customer, looking at why they do the shopping there, whether they are poor people shopping there, and so forth. So we also did accessibility mapping using GIS. Here is 1 kilometer buffer. The ring is 1 kilometer apart from the the red one is the location of the shop, while the ring is at 1 kilometer apart, meaning the further out here is like 5 kilometer. And this one is 2-kilometer buffer from the shop where, well, we see where the area that is like lacking of coverage. This is just one method of looking at accessibility. There are other methods that we can use, for example, service area analysis, origin destination analysis, and so forth. So we did the interview with about 170 customers in the shop. We went to the shop and stay in the shop, and then when people come, we try to ask them whether they will be willing to be interviewed. We look at the food they purchase. Well, about 30% of them just go there because they pass by. It's not that they truly wanted to go there. But there's some genuinely going to this shop just to purchase the food because of cheaper price. The closest that I found is in Limbang. I went to Limbang a few days ago and I saw one of the shop in Limbang. So they have also one in Limbang, and this is open throughout Malaysia. Okay, I'm coming to the end now. As I said, this stage now we are trying to map the indicator. Then we are going to combine all the indicator using spatial statistics to identify which area are actually being deprived of health, education, higher education, access to urban area, and so forth. And then we have to do field survey. In this kind of study, GIS alone wouldn't help much. We still have to go doing field study and interview the poor or interview the household to understand truly whether this is a problem or not. What we can do using GIS is that we try to identify pockets of deprived area that we expect to have problem with poverty and deprivation. But to understand fully, we still need to do field survey, which we plan to be done soon. And then, of course, with this kind of study, we have problem with data. It's very difficult to get data at a local level. Mukim level, even few years ago they released, but now with recent statistics, they didn't want to release. And then we purchased data more than, it cost us more than 15,000 Malaysian ringgit to purchase the data, and yet they didn't want to give us the locational information in terms of Mukim or sub-district level or district level. They didn't want to give us that. So we are now trying to calculate on ourselves using Malaysia. We have e-kasih data, meaning that the government have put out a portal where if somebody is poor, they can register with this portal, and then we're trying to get access to the data, that data now, and then we are trying to calculate on our own in order to develop our model. If not, we couldn't do much with the national level data. The problem with poverty is that I involved with several projects dealing with poverty. The thing is that when you enter the university, you want to graduate. But for the poor, they didn't want to graduate. That's the problem. Meaning that once they enter the list as a poor population, they didn't want to go out because they want to continue getting help. Yeah? That's the problem, because the list is keep increasing. Our target is like to reduce the poor population, giving that, empower them, giving different support, for example. But the thing is that they still didn't want to move out because they felt that the 400 or 500 ringgit they got from the government is a lot of money. They didn't want to do so much. That's the problem. I don't know about. I think that happened across the regions. Many people are. Many poor population are facing that problem. Okay. With that, I thank you for your attention. Thank you very much.
Thank you very much, Dr. Narimah, for